Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and try to take actions to make a better system for all of us. Today we're going to talk about green spaces in health and a number of other topics, but before we do, let me point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. That is the text for this video, and it has all the background material and studies and research information that I reference in this talk. So let's get started. The University of Louisville's groundbreaking Green Heart Louisville project found that people living in neighborhoods where the number of trees and shrubs was more than doubled showed lower levels of a blood marker of inflammation than those people living outside the planted area. General inflammation is an important risk indicator for heart disease and other chronic illnesses. Now, to understand the state of the community's health at the start of the study, researchers took blood, urine, hair, and nail samples and documented the health data from 745 people living in a 4 square mile area of South Louisville. The researchers also took detailed measurements of tree coverage and levels of air pollution in the area. Following the baseline data collection, the Environment Institute worked with the Nature Conservancy and a host of local partners and contractors to plant more than 8,000 large trees and shrubs in designated neighborhoods within the project area. Those living in the greened area were considered the treated population, and the results obtained from this population were compared with residents of adjacent neighborhoods where the project team did not plant any trees. Now, after the plantings, the research team reassessed the residents' health, and they found that those living in the greener areas had 13 to 20% lower levels of a biomarker of general inflammation. It's a measure called high sensitivity C-reactive protein than those living in the areas that did not receive any new trees or shrubs. Higher levels of HSCRP are strongly associated with a risk of cardiovascular disease and are even stronger indicator of heart attack than cholesterol level. Higher CRP levels also indicate a higher risk of diabetes and certain cancers. These findings were presented by Daniel Riggs, the University of Louisville Assistant Professor of Environmental Medicine, at the 36th Annual Conference of the International Society for Environmental Epidemiology in Santiago, Chile on August 26th. And if you look in the newsletter, you'll find a link to his report. Here's another one about healthcare and disinformation. It's called Show Me Your Papers, Republican Disinformation Campaign in Healthcare. Recent actions in Florida and Texas newly require hospitals to request immigration status from patients with the aim of assessing the cost of providing care to undocumented immigrants. Now, keep in mind that non-citizens also means a legal immigrant. Hospitals must also inform patients that, as required by federal law, their responses will not affect their care. In Florida, the hospitals must also indicate that the response will not result in a report to immigration authorities. Excuse me, this requirement is not specified in the Texas executive order. What a charming place. Under federal law, hospitals are required to provide emergency screening and stabilization services to all patients seeking emergency care. Now, in both states, non-citizens make up about 10% of the population, both undocumented and documented. It's about 2 million people in Florida and about 2.8 million people in Texas. Undocumented immigrants now are less likely than citizens to report using health care, including emergency care. Further, immigrants, including undocumented immigrants, have lower per capita health care expenditures than U.S.-born citizens, and data suggests that they actually subsidize health care for U.S.-born citizens by paying more into the system through health insurance premiums and taxes than they actually utilize. Florida released a public dashboard, and you can find a link to it, of course, in the newsletter, and a separate report submitted to the state legislature based on hospital reporting under the new requirement for June to December of 2023. These reports show that less than 1% of inpatient admissions and emergency department visits were among patients who identified themselves as not lawfully present. The state extrapolates an estimate that the cost of care provided to undocumented immigrants over this period was about $556 million. However, noted by the state in the legislative report and others, it is unclear how much of that care was uncompensated. Costs of care for undocumented immigrants may be covered by self-pay, they may have private insurance, or in some cases using emergency Medicaid, now which is emergency care provided to an individual who would otherwise be eligible for Medicaid except for immigration status. So they collected the value of the care, but they did not actually break it down into how much taxpayers had to pay. So this is sort of like a waste of time. So what we have is a state requirement designed to collect data to be used as ammunition to fuel sentiment against undocumented immigrants, and the data they're reporting is faulty since they don't indicate whether the value of the care was actually paid for by insurance or self-paid. And so it appears that the public is picking up the tab, but likely or not. I don't know about you, but here the government in these states are using taxpayer dollars, wasting hospital employees' time to collect and report the data, and then using it as anti-immigrant disinformation. You can find a link to the Kaiser Family Foundation where I found this. All I can suggest is to vote accordingly this November, and as we say in the vernacular, throw the bums out. Let's talk about medical debt again. Over 100 million Americans are currently struggling with medical debt. GoFundMe actively takes in hundreds of millions of dollars a year for medical bills. Hospitals are sometimes the worst offenders with respect to medical debt. Garnishing wages, foreclosing homes, yes, they really do that. Selling debt to aggressive debt collectors who harass patients who should be spending time healing instead. 2/3 of all bankruptcies in the United States are actually caused by medical debt. Okay, look, the real answer, of course, is universal health care like H.R. 3421, the vastly improved Medicare for All Act, which would cover all of us without copay or deductible, and it would manage care regionally through global budgets to make sure that we all have access to care. No copay and no deductible means no debt. Just keep that in mind. Now, there has been some progress this year. We found that the Biden-Harris administration is having credit agencies remove medical debt from credit score reporting. It's not a gift. It's actually based on the fact, on evidence, that it turns out that having medical debt does not predict creditworthiness with respect to other debts like rent or mortgage or car payments. Aha! So we should not include it in your credit score. There are nonprofits, though, that do buy up and discharge medical debt for about a penny on the dollar. One of them has a cute name. It's called Undue, U-N-D-U-E, medical debt is one of those. And we saw last week that a number of cities and states are actually eliminating medical debt for tens of thousands of their residents with such organizations. And I have a link to some of my news articles there. Now a bill has shown up in Congress to rein in collections and buy down medical debt. Its number is H.R. House Resolution 9129, the Patient Debt Relief Act. Now, the core of the Patient Debt Relief Act is a grant program directed by the Department of Health and Human Services that enables nonprofits to purchase medical debt from hospitals, significantly reducing the financial burden on patients. The medical debt, as I said, is purchased for about a penny on the dollar, according to Undue Medical Debt. Authorized at $100 million, This bill would provide a $10 billion relief to patients. This is a cost-effective way to provide relief to struggling patients. The bill also requires hospitals to offer repayment and assistance programs prior to referring medical debt to collection. The co-sponsors so far, I'll tell you, are Representative, I want to get their names right, Horsford Stevens in Nevada, I'm sorry, I've done it incorrectly. Let me take a step back. The co-sponsors are Stephen Horsford, got his name wrong, in Nevada, Paul Ruiz in California, Sri Thanadar, I hope I got that right, in, I think, Michigan, Kim Schreier in Washington, no surprise there, Nanette Diaz-Berrigan in California, Melanie Stansberry in New Mexico, Sheila Chilius McCormick, I hope I got that right, in Florida, and Eleanor Holmes Norton in the District of Columbia. She's a member of the House at large. Is this perfect? No. But sometimes politics is like taking the bus. You get on the one that gets you as close to home as you can go. So let's take an action. Let's ask our member of Congress to sign on and offer relief to people who really need it by co-sponsoring and loudly supporting this bill. Now, I'll tell you, I'll put the list of co-sponsors in the YouTube description box, and I'll put a link so that you can either call or email. And if your representative is sponsoring, big thumbs up, send them a thank you note. Otherwise, you can use ResistBot on your cell phone and send a text message to 50409. The message is sign, S-I-G-N, space, P-G-A-J-R-C. So that's sign, space, P-G-A-J-R-C to 50409. And here's the message you'll send. I'm your constituent, and I want you to know that 100 million of us have medical debt and we cannot handle it. Now you can do something about it. I want you to co-sponsor and support H.R. 9129, the Patient Debt Relief Act. It will make hospitals offer assistance with bills to those who need it before going to collection, and it will allocate a grant to clear out $10 billion of medical debt for a penny on the dollar. Look, the best solution is really universal health care, like H.R. 3421, where patients don't incur the debt in the first place. But until we have that, I want you to support the Patient Debt Relief Act. Thank you. That's what I've got for you today. Down below, you can like, share, subscribe. Everything I told you will be in the YouTube description box will be there. You can also send me comments and suggestions at healthcareadvocacy1, all one word, @gmail.com. Thank you.